Hey guys, it's Dr. McDaniel here at Avana Plastic Surgery. So we're going to meet one of our patients who's having a pre-op done today for surgery tomorrow. We're going to be sizing her to pick out her breast implants. She's going to look great, so check it out and see how the process works. Hi, good morning. Dr. McDaniel.
Nice to meet you. Okay, I think you wait.
So you can see, it's going to be a big difference. And it's still going to be bigger than that.
¿Qué vas a ser más grande que?
Sí.
Está bien. Oh my god.
Are you excited?
Yeah.
Alright guys, so we're here with my beautiful patient. She's 23. She's been excited about getting a breast augmentation for some time, and tomorrow's the big day. So we've already sized her, we've measured the width of her breast, the distance from her nipple to her fold here, and we've picked out 365cc high profile or full profile silicone implants. It's going to be nice for her because she wanted to go from an A to a full C or a small D, and I think that's going to fit her great. You know, it fits within the frame of her breast mound here, and it's going to give her more projection that she's really looking for. It's going to be a nice change. So I'm excited, stay tuned, we'll show you the before and afters as well. Good morning guys, so it's the big day for your surgery. We're here in the preoperative area. We're going to mark everything. We're going to go over instructions for after surgery as well as kind of what to expect tonight and things to do to be safe and things to watch out for. So now when I'm marking, what I'm doing is I'm going to mark the midline here so we can make sure that the breasts are centered, have the similar cleavage on each side. And her breasts, you know, they're pretty similar in size. So what I do first is I kind of mark what I call what is the inframammary fold. So that's going to come down here. And it's going to mark right around just like this. Now sometimes that needs to be adjusted. In her case, I don't think it does because we're not doing too big of implants. We're doing 365cc high profile implants. So now that we've got the inframammary fold marked out here, I next mark the superior aspect of my dissection. So that's going to extend up here, just like this. And it's going to connect down here. And these are going to connect underneath the fold. I'm going to place the implants under the under the muscle here. So the incision is going to be here, and it's going to lift up this pec major muscle to bring the entire implant, or the implant will push out the muscle as well as the gland. So it's going to look really, really nice. It's going to look very natural, but have a nice change with more fullness and cleavage afterwards. So stay tuned, and we're going to show you the final results once we're finished. Marking where the incision is hopefully going to be. With silicone implants, the incision does need to be slightly larger than saline because it needs to fit the implant through it when it already is filled. Whereas with saline, we put the implant in deflated and then fill to the appropriate volume. So here I'm going to mark for a 3 centimeter incision, which traditionally it's about 4, but with hers, again, the implant is a little smaller, so I'm hoping to keep this a smaller incision. If we need to extend that in surgery, we can, but right now I think that this is going to work just fine and it's going to be nice. So this is the only incision you're going to see from here to here on each side, and it's going to sit underneath the implant and turn out really nicely. Okay, so we finished the case now. You can see where we had marked. It's exactly where we ended up placing the incisions, and the breasts fit perfectly. It's not too wide. What I worry about a lot is that breasts are going to be wide and not fit someone's frame. So that's what a lot of the measurements come into play, and this came out perfect with just the right amount of cleavage. I think she wanted to, so for people to know she had a breast implant placed, but nothing that was overwhelming and didn't really match her body. So it fits great. Check it out. I know she's going to be thrilled. Let me know what you think in the comments below. How are you feeling? Good?
Good.
How was your night? A lot of pain?
So-so.
Okay. You look like you're doing great.
Yeah.
Alright guys, so we're now post-operative day 1 after a breast augmentation. It really turned out nice. We've done 365cc high profile implants, and really on day 1 the implants are going to be sitting high. I placed them underneath the muscle, so as that spasm the implants shift up, and that can take sometimes 8 to 12 weeks to really settle down. So today what I'm really looking for is making sure there's not a really big asymmetry that could indicate some type of bleeding or other problems, and I'm looking to make sure that they're both the same height and the same size. And like I said, everything looks perfect, beautiful result, so I'm really happy for her.